Hi, I'm Dr. Wesley Shankland from Columbus, Ohio, and welcome to our YouTube video channel on Temporomandibular Disorders. Today I want to talk about something that's kind of interesting, finding the correct doctor. I get comments, I get questions from people all over the United States. How do you find the right person to see? Do I see my family physician? Do I see an internist? Who do I see for this problem? And so we have to talk about this a lot because the temporomandibular joint, for example, this is the temporal bone, here's the mandible, and we have to worry about this disc right between the two bones, the temporomandibular joint. But that's just one section. See, TMJ problems is just one section of problems with the head and neck pain disorders. And we have problems with the muscles, the nerves, the ligaments, the cervical spine, and so all those areas have to be addressed. And so who do you actually see to treat these problems? So if you have a problem, if you had a mole on your skin, who would you see? Would you see a dermatologist? Would you see a plastic surgeon? Both could be correct. Maybe a plastic surgeon, maybe a dermatologist, doesn't matter. But you've got to get to the right doctor. But when it comes to the TM joint problems, is an orthopedic surgeon? They used to treat these problems before World War II. Would it be a physical therapist, a chiropractor, massage therapist? Who do you see for these problems? So let's talk about the kind of doctor or therapist you'd see to treat these problems, because you've got to get to the right person or else you might have delayed treatment or not have treatment at all. I want to show you a few places to go to get the right kind of person to treat these disorders. When considering treating the TMJ problem, who do you go to first? The first person you should contact is your family dentist. Dentists are trained to treat these disorders. Not all of them do this, but they're trained to do this. Your family dentist is the one you should contact. He or she may have some training, may want to treat these problems, or she may refer you to an oral surgeon or to an orthodontist. Now, I'll tell you this, most of the orthodontists I know don't really like to treat TMJ problems. They are absolute experts in treating malocclusions, treating malformed jaws, but they don't really want to deal with TMJ problems. And oral surgeons are brilliant people. I consider them the neurosurgeons of dentistry. They're very smart people. They're very good surgeons, but they rarely treat TMJ problems anymore. They only do surgery, and most oral surgeons won't do surgery anymore. So what do? You talk to your dentist to see if he or she wants to treat these problems, and if they don't, then there are a few places you can go. The first would be the American Academy of Craniofacial Pain, AACFP.org. I was on the board of directors for about 15 or 20 years of this academy. I actually was president of the academy for 2 years. This is a clinically accepted, clinically applied group of dentists around the United States and Canada who treat oral facial pain and TMJ problems. This is probably the best place to go to find a dentist. You can go on their website and get a location of somebody in your area. The second group would be the American Academy of Orofacial Pain. I was on their board of directors too. It was called The Session at that time. And this is a good group of people. A lot of them are academics who are with universities. That's where you may go to their website. And that is AAOP.org. That's a good place to go to get some names. A third place is the American Equilibration Society, AES-TMJ.org. This is the oldest group, most likely, of TMJ disorders and dentist treating. I used to belong to this group as well. This is out of Chicago, and that's a good group to go to, too. So the first thing you want to do is go to your family dentist, see if he or she wants to treat your problems, and if they do, then work with them. If not, then go to one of these three groups and see if you can find a dentist in your area who will treat these problems, or maybe send you to somebody. So this is the first part of this discussion. We're going to have another discussion, even more in depth, discussing what you should talk with dentists about if you see them to treat the TMJ problem. But I hope you've enjoyed this. I hope you understand there are places to go, so don't be upset. And if you really don't know where to go, you can contact my office, drshankland.com. We will absolutely try to find somebody in your area to help you. Thank you very much for watching. Thank you.